Hi, my name is Dr. Dev and this is my assistant Barney. Hey Barney!
Hello, Dr. Dev.
Sorry.
Today we're going to talk about how to stop snoring. You know what? There's a lot of BS around, so this video will cut the crap and let's get down to business. As a sleep doctor for over 25 years, one of the commonest questions I get is, Doc, my snoring is irritating everyone, including the missus or the partner or the husband. Now, snoring is an interesting phenomena. It's that vibration and rattling of the back of the palate, back of the tongue. It can be nasal, palatal, back of the tongue. Now, you know, that is really irritating. And so if you have snoring and it is bothering your partner, time to stop, buddy. But how are you going to do that? Now, there's many ways of stopping snoring on YouTube or on Google, but I'm afraid a lot of them is just basically BS. So it's time to give you a few tips and try and get rid of that snoring. Now, for those who put a bit of weight on, then you're a bit heavy around here, then yeah, that's a big common cause of snoring. But I do see a lot of people who ain't that heavy and not put much weight on, and their snoring is hideous. So hideous that the partner thinks they're hideous too. And that might be down to tonsils, it might be down to the back of the palate or the tongue or the jaw structure. So first tip is, for those where weight isn't an issue, maybe try and get a ear, nose and throat opinion and see if there's any blocked nasal passages or adenoids or tonsils that's driving this snoring. If you have snoring and you're stopping breathing as well, then you might have something called sleep apnea. So tip number 2 is go and get a sleep test. Go and work out whether the snoring is also associated with sleep apnea or stopping breathing. So the snoring may not be a continuous machinery, but it's a then stop and then, and that's what the partner will tell you. It's not the snoring that irritates them, it's the gaps in the snoring. But if you've got sleep apnea, there's ways of treating that, and I'll mention those in a second. Now, some of the things that's on Google and YouTube and wherever that say will treat the snoring, frankly, they just don't work. One of them might be nasal prongs, or these things that just you stick up the nose like this, and I'll just demonstrate this. And yeah, it can certainly reduce the nasal passageway resistance or increase the size of the nasal, but to be honest with you, it's not going to stop the snoring if it's coming from the back of the throat to the back of the tongue, and you know, they just ping off and fall off. The other thing that some people use, and I've got a demonstration here, is the chin strap, and you put this over the chin and the mouth, and it keeps the mouth closed. And the thing is, if you can't breathe through your nose, then how are you going to breathe through your mouth as well? So, and again, it doesn't work, flings off. It might be good for allowing you to breathe through your nose and keep and prevent the dry mouth, but actually if you've got heavy snoring due to being overweight or the palate or the airway structure, then it isn't going to work. The other thing that some people have been using, and with variable effectiveness, is the mandibular device splint, and it looks like something like this, and you just basically let me just translate that. So you put it in your mouth, and what it does, it keeps your mouth closed, bring the jaw forward, prevents the tongue from falling onto the back of the palate, and improve the airway dimensions and reduce the fluttering and the snoring, that turbulent airflow. It converts it to laminar airflow. Certainly there's various options. You can get one over the internet, and it's a boil and bite, where you just basically put it in boiling water and it goes all soft, and then you just put it in your mouth, obviously dry it first, and then it sort of stiffens, and then it's like a rugby or a hockey gum shield. If that sort of works a little bit, but it's quite uncomfortable and you can't really quite fit it in your mouth because it doesn't quite fit, you can go to your dentist and get one made to measure. That will actually be much more comfortable. But if your snoring is still terrible, then what are you going to do next? Well, look, if you've got sleep apnea and your snoring is hideous and your partner is at the front door with the cases.
Skylar.
Could you do me the courtesy of not denying it?
Don't just say to her, bye. I think you really need to do something that will treat the snoring and get her back into the bedroom, or get him back into the bedroom. And if you have sleep apnea, one of the ways of treating that is the CPAP machine, continuous positive airway pressure. Here we go, little box like this. And what you do is you pop this piece of mask over the nose. Here we go, demonstration with the straps to hold it in place. So when you breathe in, the machine blows in, and when you breathe out, it still blows in to keep the airway nice and open. And what it does, it just converts all that rattling, the palate and the tongue, all that turbulence into more laminar flow. But I'll tell you what though, not only does it improve the stopping breathing, but it improves the snoring immediately. Absolutely, immediately. And I have a lot of patients on CPAP who've done very well. Now, for you out there who says, well, I'm not going to use CPAP machine because I'm wearing this mask, I look like Darth Vader, mate, I think, forget Darth Vader, I think you look like Princess Leia. You're not going to look like anybody else.
Where is the rebel base?
But the noise goes. The noise goes. Happy wife, happy life, happy husband, happy whatever. But it'll treat the snoring. So I would certainly consider even thinking about the CPAP machine. If you've got sleep apnea, you've got heavy snoring, if you tried everything else, you try the thing to stick up your nose, you try the thing to stick up whatever you want, and it doesn't work, then it's time to cut the BS and use and try something that works. So if that's something you think might well consider, go and see your sleep doctor, go and get a sleep test, rule out sleep apnea, maybe get an ear, nose and throat specialist. You can try all the gadgets that's available online, but you're going to spend a lot of money and it's not going to work. So get it fixed, get it checked out. Happy life, silent nights, happy days. See you next time.